Thank you, Flo. So as you say, I'm going to talk a little bit about the CALCiViS imaging system and how it gives us some additional information about the dynamics of demineralisation. So I'll cover, as I say, how the system works, a bit of the science behind the technology, some of the proof of concept studies that we've performed, and how we've validated the system in the clinical setting. The current tools available are very subjective, but not only are they subjective, they're quite retrospective. So we're seeing historical damage to the tooth surface rather than what's actually going on with the disease process. So the CALCiViS system allows us to visualize the active demineralisation, and that gives us a chance to see which lesions are actively deteriorating and which are maybe arrested. It also allows us to see the switching off of this process and the effectiveness or not of the interventions that we use. So if we look at this slide with the images, so we've got images from an intraoral camera and images from the CALCiViS system. And if we look at the intraoral image, we can see this classic white sort of chalky area, which any trained dentist will tell you is indicative of demineralisation, of active stance on that lesion. It's very difficult to explain that to a patient. But if we look at the CALCiViS images, and we can see these clear hotspots of activity where there's calcium leaching away from that crystalline structure, it's much easier to present that to a patient. So how do we obtain these images? So again, coming back to the crystalline structure in the enamel, when that comes under attack from acid, calcium ions are released. It's a normal chemical process, and that's demineralisation. We also see remineralisation when calcium goes back into the crystalline structure. But what we're seeing is in the case where demineralisation is outstripping the remineralisation, we start seeing the crystalline structure breaking down, little pores and pits where we get the calcium ions accumulating. So with CALCiViS, we have a recombinant photoprotein which reacts very specifically with those calcium ions to give a burst of light. And it's quite important. A couple of things to note is this is not fluorescence, so we're not shining an excitatory light and looking for a change in the light coming back. We're actually looking at a direct reaction between the photoprotein and calcium ions that releases this light. And the other point to note is that the photoprotein cannot bind calcium that's in a crystalline structure. It just can't get to it. So in a normal crystalline structure in the enamel, we can't actually get a signal. It's only when that calcium is set free and sits there ready for the photoprotein to pick up. So it all sounds very simple, but there's a number of challenges in putting the system together, and one of the challenges is the speed of this reaction. So the photoprotein actually reacts within milliseconds. So if we look at the flash dynamics in this chart, we can see that the peak output of light is within 10 milliseconds. And if you've left it by a tenth of a second, the signal's gone completely and you won't see anything. And Chris has had issues with this in the past where, and also us as well, when we've tried to image teeth, and I know Chris had freshly extracted teeth that he would run down to the lab to get it into a dark room to get the images performed, and then turns around to the technician and says, "Okay, go." And the technician says, "What do you mean?" He says, "Put the photoprotein on." He says, "I've already done it." He says, "Oh, well, we must have missed it," because it is such a quick reaction. However, the way we've got round this is using a system where we can integrate a syringe drive into an intraoral camera. So it's a very sensitive intraoral camera that picks up this very faint flash of light. And the photoprotein is drawn into the syringe, slotted into the belly of the machine, and an applicator is clipped on the top. Now the applicator has multiple functions, so the applicator will prevent cross-contamination from patient to patient, will also channel the fluid onto the tooth surface from the end of the syringe, and will block out any external light. So by positioning it over the tooth surface of interest, we can get a live video stream. And what I'll do is I'll show you a brief video clip just showing what this looks like in practice.